Hello, welcome to my channel. I'm going to explain how to prevent diabetes. But before we go to how to prevent diabetes, I just gonna explain to you why you want to prevent diabetes. Many of us, I think, know someone that has diabetes in family or friends or anyone. It's a common disease now that if you get this disease, you won't heal anymore, but they will only fix the symptoms of diabetes, but you can't put it back anymore. So it's better you prevent it because no more turning back once you have this. First is skin. If you will have diabetes, you will have damage to small blood vessels and nerves, and this can cause very dry skin. And if you will have very dry skin, this will lead to small cracks in the skin and overwashing and excessive hot water and exposing to the sun. And if you're not moisturizing your skin, it can make the problem worse, like you will have cracked skin. And if you have cracked skin, infection can easily go to your bloodstream, so it's not really good. And if you will have diabetes, you will have problem with sexuality. Both men and women with diabetes may lose their sexual desire when their blood glucose levels are high. Men are higher risk of erectile dysfunction or impotence, especially if their diabetes is not well controlled. So that will be your second problem if you develop diabetes. So please prevent diabetes if you can, if you don't have it yet. If you will have diabetes, you might also have problem with mental health. Actually, 50% of people with diabetes are thought to have mental illness, such as depression and anxiety. People with diabetes and depression together may have increased risk of complications, as they may find it harder to manage everyday tasks. So diabetes and depression is not good to have together. So if you don't have diabetes yet, please do extra careful in your life preventing it. If you have diabetes, you may have bladder and kidney problem as well. Diabetes can cause kidney damage, which causes them to leak protein in the urine. You won't notice it until it's advanced. So you need like annual blood tests of your kidney just to check your kidney function. Bladder and kidney infection as well. You will have bladder and kidney infections regularly if you have diabetes. If you get diabetes, you may have vision problem as well. Diabetic retinopathy. It's the damage to the back of the eye. It's actually the leading cause of blindness in Australians under 60 years old. So if you don't have diabetes, please do extra careful or research about how to prevent it. Actually, you can be blind. If you may get blind if you have diabetes. The most common problem that people that I see personally with diabetes is legs and feet. Problem in their legs and feet. Diabetes can cause nerve damage and poor blood supply from damaged blood vessels that can lead to pain, leg ulcers, and amputations. Imagine because if you will have diabetes, whatever wound you get will have difficulty in healing. So sometimes it can lead to amputation and pain and leg ulcer. Ulcer is kinda wound that is not healing, and it's very painful and sometimes smelling. So if you don't have diabetes yet, please extra careful of watching your weight and everything. I'll let you know later how to prevent it. If you will have diabetes, you may also have problem in your eyes, nose, and mouth. And you will also have tooth problems and gum disease every now and then because of all the moist area. Yeah, something like that. I don't wanna explain it a bit more. So that is the reason why you want to prevent diabetes. Please do so to prevent diabetes. If you don't have diabetes yet, you need to start now. If you don't want to have these problems like very dry skin all the time, you will have problem on sexuality, you will have problem on mental health, you will have problem in your bladder and kidney, you will get infections every now and then. Not will, but may. You may have problem on vision and it can lead to blindness. Imagine you only got diabetes and then you became blind. No way. And you might also have problems on your legs and feet. Plus imagine pain. You will have pain. You might have pain all the time if you have that. And problem on your dryness of your eyes, nose, and mouth. It's too many problems to carry if you only have diabetes. So we'll go back to how to prevent diabetes. This is my topic, how to prevent diabetes. You only have to do two things. Watch what you do and watch what you eat and drink. In watch what you do, there's three. Watch your sedentary lifestyle, control your weight, exercise, and then watch what you eat and drink is watch your water, watch the servings of your food, watch the sugar and carbs that you eat, and watch the processed food that you eat. Anyway, before I tackle all of these things, where is that now? Hang on a minute. Okay. First of all, what is diabetes? What is diabetes? Diabetes, it occurs when your body is no longer effectively regulate blood sugar level because your pancreas sorry, I ran there. Pancreas stops producing enough insulin, or your cells become resistant to the insulin that is produced by the pancreas. So, what pancreas look like? This is the pancreas look like. It's like a kikiam, and it's like a corn. Like there's some, you know, some like this, like a corn. And it's just, this is the small intestine. It just lie on that side of the intestine. And this is the head of the pancreas, body, and the tail. Pancreas is connected to the end of the small intestine called duodenum. So pancreas, it's a 6 inches, 6 to 10 inches, and it sits across the back of the abdomen behind the stomach. And pancreas produces insulin to lower your blood sugar level. Blood sugar level is obviously blood sugar level, the level of sugar in your blood. Glucagon to increase the blood sugar level of yours. If you have a healthy pancreas, the level of your insulin and glucagon will be good. But if your pancreas is not good, it means you have diabetes, and you won't be able to control your level of your sugar in your blood. You will have a lot of sugar in your blood. Imagine if you have a lot of sugar in your blood. Sometimes it can make your blood vessels marupok, something like that, or makunat. Yeah, I don't know what's the English of it, but yeah. So I'm going to explain to you how to prevent. So this is really my topic, how to prevent diabetes. That one. We'll start with maybe sugary carbs. With sugary carbs, where is that? Sugary carbs. Yeah. Watch your sugar and carbs, because sometimes when sugar and carbs, your body, it says here that eating sugary foods and refined carbs can put at risk individuals on the fast track to developing diabetes. Your body rapidly breaks this food down into small sugar molecules, which are absorbed into your bloodstream. The resulting rise in blood sugar stimulates your pancreas to produce insulin, a hormone that helps sugar get out of the bloodstream and into your blood cells. So it means if you drink or eat sugary food and carbs, like a lot in one sitting, your body will stimulate the pancreas to produce insulin, because the insulin is a hormone that helps get the sugar out of the bloodstream, because we are not allowed to have a lot of sugar in the blood. The sugar needs to be in the cell, in the body cell, not in the blood. And the insulin will help the body is a hormone that helps sugar to get out of the blood. So when you, that's why when you prick and something like that. In people with, yeah. So we'll just go back to this. I will just go to the next. I hope you understand that. Next one is work out regularly. Where is it? Sorry, I'm not very organized. Watch your exercise habits. Performing physical activity on a regular basis may help prevent diabetes. Exercise increases the insulin sensitivity of your cells. So when you exercise, less insulin is required to keep your blood sugar levels under control. It says on the study, one study in people with prediabetes found that moderate intensity exercise increased insulin sensitivity by 51%. And high intensity exercise increased by 85%. However, this effect only occurred on workout days. So, if you have moderate intensity, your risk of having diabetes is, your increased insulin sensitivity increased in 51%. So your body will be sensitive to insulin by 51% if you moderately exercise, and it will be sensitive to insulin when by 85% when you high intensity exercise. So high intensity exercise is better. Third one is watch your water intakes. Water is by far most of the natural beverage you can drink. What's more, sticking with water most of the time helps you avoid beverages that are high in sugar, preservatives, and other questionable ingredients. Sugary beverages like soda and punch have been linked to an increased risk of both type 2 diabetes and latent autoimmune diseases. So, yeah. The next one is watch your weight. Although not everyone who develops type 2 diabetes is overweight or obese, the majority are. What's more, those with prediabetes tend to carry excess weight in their midsection and around abdominal organs like the liver. This is known as visceral fat. Excess visceral fat promotes inflammation and insulin resistance, which significantly increase the risk of diabetes. Although losing even a small amount of weight can help reduce this risk, studies show that the more you lose, the more benefits you'll experience. One study of more than 1,000 people with prediabetes found that for every kilogram of weight participants lost, their risk of diabetes is reduced to 16%, up to a maximum reduction of 96%. So if you try to lose weight, your risk of having diabetes is more increased. Tama ba? Yeah. You won't have diabetes if you lose weight. You can Google the BMI, the normal weight for your height. You can calculate it. It's like 5'1". The normal weight for them is 45 to 59. So, but just have a look on the Google about the BMI, and just watch your weight, that you just go according to that, to what they said, that allowed weight for you, for your height. So watch your weight. The next one is watch your portion, watch your servings. Whether or not you decide to follow a low-carb diet, it is important to avoid large portions of food to reduce the risk of diabetes, especially if you are overweight. Eating too much food at one time has been shown to cause higher blood sugar and insulin levels in people at risk of diabetes. A 2-year study in pre-diabetic men found that those who reduced portion sizes and practiced other healthful nutrition behaviors had 46% lower risk of developing diabetes than men who made no lifestyle changes. So, yung risk mo naging half. Almost half, 46%. Just to reduce your servings. You can eat cake, but not big cake at one go. You can eat like now and let your body digest the food, and then you eat again the next day. And if you eat cake, just lessen your Coke, and don't drink Coke at all, or lessen your juice, orange juice and all that. Just drink water if you already ate cake. It's like when you eat, you have back on your mind that you're counting your sugar intakes. Like if you put sugar already on your tea, you need to reduce the cake. And if you drink a lot of orange juice and those sugary juice, you reduce your cake. It's like you just count every day at the back of your mind that you're counting your sugar intake. Because sometimes we just eat and eat without conscious mind of how much sugar we already take, and we didn't realize that the amount of sugar that is allowed for a week, you already ate it in one meal, which supposed to be it's for the whole week of sugar. Which, you know, if you put too much sugar on your body, like cakes and juices and ice creams, and in one sitting, your pancreas will work harder, and if you make them tired or something like that, in long run they might, give up, something like that. I don't know. So yeah, and the next one is watch your sedentary behavior. It's important to avoid being sedentary if you want to prevent diabetes. Sedentary is like you just sit down or you lie down doing nothing for longer periods of hours, like maybe 8 hours, 4 hours, 2 hours. You're just sitting down, you're not doing anything, and you do that every day and every day, and that is a sedentary lifestyle or behavior. If you get no to very little physical activity and you sit during most of your day, then you lead a sedentary lifestyle. Observational studies have shown a consistent link between sedentary behavior and the risk of diabetes. A large analysis of 47 studies found that people who spent the highest amount of time per day engaged in sedentary behavior had 91% increased risk of developing diabetes. So you will double your risk of having diabetes. Risk is chance. You will have more chance of having diabetes if you have sedentary behavior. It's 91%, according to 47 studies. Changing sedentary behavior can be simple as standing up from your desk and walking around a few minutes for a few minutes every hour. So when you watch movie at home, just pause it and just stand up and stretch and walk for 5 minutes or 2 minutes. Then you continue watching the movie or like that. Changing sedentary behavior can be as simple as, Unfortunately, it can be hard to reverse firmly entrenched habits, sabi sa website. The last one is watch your processed food intakes. Processed food intakes. One clear step you can take to improve your health is to minimize your consumption of processed foods. They're linked to all sorts of health problems, including heart disease, obesity, and diabetes. Studies suggest that cutting back on packed foods that are high in vegetable oils, refined grains, and additives may help reduce the risk of diabetes. This may be partly due to protective effects of whole foods like nuts, vegetables, fruits, and other plant foods. One study found that poor quality diets that were high in processed foods increased the risk or chances of diabetes by 30%. However, including nutritious whole foods help reduce this risk. So that's the ways of how to prevent diabetes. If you don't want to have diabetes, because having diabetes again can have all this, may have all this as well. May have all these problems as well, that diabetes, complications of diabetes, like those problem in your eye, nose, and mouth. You will have dry mouth, dry eyes. And imagine the medication, the medicine to buy that diabetes medications. It's too expensive, the insulin, the metformin, and all that. So it's better to avoid this while you are young and while you don't have it yet, because you might get amputated, you might get pain. Imagine the life of you will have pain all the time. I don't like that. You may be blind, so, and you may get bladder infections, kidney infections every now and then, which you don't want it to happen. You may have mental health problems like depression and all those things. Imagine you might have sexuality problem like erectile dysfunction and impotence if you don't prevent having the diabetes. You may also have skin problem. Imagine your skin is always dry and cracking, and you might get infection if your skin is cracked, because when it's cracked, the germs can come into your blood and it can travel to your heart or to your brain. So it's not very good. So while you don't have the diabetes, please prevent having it, because it's a preventable disease. Sometimes it is preventable, but if you have family that has diabetes, you have more chance of having it. So you need to be extra careful of these things. You need to, every time you do something and eat and drink something, you have to consciously thinking and counting how much sugar you eat and how much exercise you've done for the whole day and how much water you drank for the whole day, and you're consciously thinking how much servings and processed food for the whole day and for the whole week and month, and make it a lifestyle. You do it every day for the whole life of yours until 60, 70, 80 years old. Don't stop thinking how to prevent that diabetes, because you won't really like this disease. So yeah, thank you, bye, thank you for watching. I got that information from healthline.com, www.healthline.com. So bye, thank you for watching, see you later.